My second concern, Dr. Slesnick, is that why do they actually want us to just focus on their chief complaints? Why don't they want to us to have a look at their overall health? I understand that they're coming in for a simple problem, my filling fell out, and they are the ones who are booking new patient exams. They're not just coming in for limited exams. So the exam is a new patient exam. We tell them, okay, this is what you need. And by the time I'm done telling them all the things that they need, I have lost them.
Okay, I guess the first question that I would ask to any dentist who says this is, are you clear in your mind exactly what communication goals you have to achieve at this appointment for good things to happen? And I would say that 90% of dentists aren't going to have a clue. Okay? Communication is as critical as what you do with your hands. And in the same way that what you do with your hands has to be precise, that you know exactly what you need to do to be successful, and you know how to get there, exactly the same thing with communication. In this situation, these are my communication targets. Hit them, things go well. Miss them, things don't go well at all. And these are my hacks, my steps for hitting the target. You have to know those.
And those hold true for every single patient that we see, or are they going
Yes.
to be variable according to?
Sure, there's flexibility. The goals are not going to change. The patients change, how we approach them change, which hacks we may use with a particular patient may change. The targets never change.
And can you elaborate a little bit more upon what targets are we looking at?
Sure, let's look at, I've been talking about first meetings. You have two targets for first meetings. The one we talked about, you have to help the patient flip the switch from being a nice tooth fixer to being a trusted friend. Okay, and let me give you the most critical hack for doing that. It takes 5 minutes. Okay, you have to ask, you don't have to, but you're well advised to ask a series of open-ended questions that are personal. And then you totally listen to it. So you don't just say, how's the weather? How is the traffic? Okay, so a lot of times I'll say, well, here's an example. Suppose it's a person from another country. I'm going to say, do you mind if I ask you where you're from originally? And they'll think I'm being polite. They'll answer, I'm from Haiti. Okay, if I drop it there, that's no good. But if I then say, oh, did you have family there during the earthquake? They'll say yes or no. And then you'll ask, each question you're probing a little deeper. Well, tell me more. How's Haiti doing now? Have you been back recently? And once you ask 2 or 3 or 4 of those questions, with each question going deeper, and you showing genuine interest, that light's going to go on in the patient's eyes, and they're going to say to themselves, he's really listening. He really cares about me as a person. Then you're creating trust. Okay, so that's the hack you're using to hit that particular target for first meetings, the essential target, which is building personal connection and trust. Second target for first meetings is you have to learn to look through the patient's eyes instead of yours. Okay, dentists think that we know everything and that our perspective is the only one that counts. I see this as a patient with periodontal problems and broken teeth and bing and bing and bing. And this is what's important and this is what's not important. Your perception doesn't matter one bit. The only perception that matters is the patient's, and you can't come to learn what that patient's perspective is unless you uncover it. They won't tell you. Okay, so your target is to learn to look through the patient's eyes to discover their perceptions. And the way you do that is by asking 4 open-ended questions. You're going to hear the word open-ended a lot with me. Okay, yes, no questions.
Well, I have actually heard a lot of these questions, in the advanced standing program. But I think now this deeper dive is actually very self-reflecting, because when you were saying these words, I have seen the changes that I introduced in the way I practice dentistry, especially my communication. But I still see that there are some gaps, because there are still some fixes that need to be done. Because I think what I got in the advanced standing program was just 1 to 2% of what the actual ocean of information lies around?
A couple things I would say. First of all, if the patient's in pain right now, everything you show empathy, you show caring and commitment. You don't do all this because a patient in pain can't hear you. A patient who is stressed out of his mind can't hear you. So you need to go ahead and bring the patient down to the point where you can have good communication. Um, so if the patient says, this tooth is really bothering me, I would say, very good. I want to hear more from you. I want to get to know you. But first, let's take a look at your tooth. Otherwise, the patient's going to feel discounted. Okay. You need to take care of the patient's needs. This patient just told you, I care about this tooth. Okay. So let them know right now, very good. Let's get an x-ray and take a look at it so know where we stand. Then we can get a perspective on what your choices are. And then we can talk some more. So let the patient be a guide sometimes. Don't force the patient to fit into the mold that you want him to. Does that make sense, Naresh?
Yes. So do you really think that when we are entering the room, is it a decent question to ask, hey, John, how are you doing today? Because I know the patient who is in pain is going to respond back with that. Or do you think there is some other approach to this greeting?
What I used to do, and again, we're talking about first meetings with new patients, okay? I wouldn't say how you're doing. I personally would say I would sit down at the patient's level in the chair, never standing over him. I would shake hands with him or her and say, hi, I'm Dr. Slesnick. I know that you're Mary. It's so nice to meet you. And by the way, this wouldn't work with Mary. I know your name is Richard. Would you mind telling me what name you like to be called? Okay, it doesn't work with Mary because you know what Mary wants to be called, but Richard can be any number of names. You'll be amazed to see how much people appreciate you asking them what name they want to be called. Okay, so right then I've showed them respect. And then I'll say, does a particular problem bring you in today? Okay, and they'll tell me, yes, this tooth up here. Okay, then I'll say, very good, that's my priority too. Confirm that you are their ally, that you understand, that you've been listening, and what's important to them is important to you. Okay? Then you're going to go ahead and take your radiographs and all that. Certainly start with the tooth that's important to them, but then you can move on. But as soon as there's a time that you feel is appropriate, okay, that's where I do want to do the steps to create that personal connection. Okay, that's when I'll say, would you mind if I ask you what kind of work do you do? And then you go through that series of open-ended questions. You're trying to show them they're not just teeth for you to fix, that they're a person.
So
Can't tell you.
is this the right way of asking, would you mind? Because normally how I approach that question, if the conversation is permitted to go in that direction, I would be like, hey, what do you do for a living? So is it too direct for us to ask, or is it like we should seek permission?
I would ask permission. Again, everything's about showing respect. So that's a really good point.
Okay. So
Okay.
you just
And I
ask
do
them
that. I
politely,
do.
would you mind?
Yes. Yeah. And that also comes in. Remember, I was talking about discovering the patient's perceptions?
Yes.
Okay. I'd say, do you mind if I ask you questions, a few questions that I ask all my patients because I really want to understand more about you? Okay. And I asked the series of 4 open-ended questions again, and I won't go through it now in detail, but the questions are, would you mind telling me what your experience with dentistry has been in the past? Okay, then you discover if you have a person who's phobic about dentistry. And I ask all my patients how they feel when they see a picture of themselves or when they smile themselves in the mirror. How does that make you feel? Okay, that's instead of saying, do you like your smile? They lie to you.
Okay.
Particularly men will lie to you every time. Okay? Because they don't want to be seen vain. But if you say, how do you feel when you smile at yourself in the mirror? They're going to tell you. Now you know if this is a potential aesthetics situation where you can help them in that way. And how do you feel about your ability to eat your favorite foods? But did you hear? You're not collecting data, you're exploring their feelings.
Hmm.
Feelings drive case acceptance. Okay. And the last question is, and this is a little bit different. How do you think your teeth are going to be doing in 5 years? How about 10 years? Because if their perception is they're going to lose their teeth, you need to know that. Okay. But I ask, as you said, I asked their permission to ask the questions. Would you mind if I ask you a few questions that I ask all my patients?
That's the beginning point. And I don't think that there is going to be a no ever to this question.
When you do it that way, yes. And can you see how much better you're going to feel about this new dentist because he's shown that respect?
100%. I definitely see a difference in the way I have asked the same questions, but the way the questions need to be structured is so much different on how you're telling, because that makes actually a lot of difference. Like if I see myself as a patient and my dentist is asking me these questions, I would feel so much better. I mean, is there something else that you would like to add on to that experience?
Just one more small point. I can pretty much hear all the dentists who might be listening to this asking themselves, well, that's great, but how much time does he want me to spend with this new patient when I've got a patient in the other room who's waiting for me and I've got an emergency in this room? And now he's asking me to do all this. It's
Elaborate
a
on that.
very valid question. But first, I'm going to tell you that if you shortchange first meetings, if you treat them as an annoyance, as a nuisance, you're shooting yourself in the foot.
Okay.
You're depriving yourself of great case acceptance. It's that important. If I were to tell a dentist, if the dentist said, what's one thing I can do that's going to make me a happier dentist and have better case acceptance and better income, it's going to be that you treat first meetings with new patients as the most important meetings in your schedule, and you can't rush them. But do you know how much time it takes to do it really, really well if you're efficient? 10 minutes more than what it takes that you're doing now. And it's the most important investment you can make. I personally believe that new patient appointments should not be side booked. I think it should be a 1 unit beyond whatever it is that you would ordinarily do.
Okay. My last question, Dr. Slesnick, is regarding at times when we go in, like we have proposed, for instance, an extraction needs to happen. And patients typically ask us questions regarding money. For example, they'll be like, okay, how much procedure A versus procedure B costs? And then it becomes so much inconvenient or uncomfortable, not inconvenient, like it's very uncomfortable on my part to talk about finances. And typically I dodge those questions, but I don't know how to actually pitch that or have a conversation from that point onwards with my patients, because I see that the moment the patient is going to ask me this question, my answer is, oh, you know what, the finances are going to be discussed by my office manager. And technically I shut down the patient over there, and that's when I feel like I lose them. How should I approach that situation?
A couple of things I want to say about talking finance with patients. I never personally got involved with any of the details. I certainly never talked about details with insurance or co-payments or any of that. I don't know how to do that. I'm not good at it, and that can be done better by a staff person. At the same time, it's critically important that dentists get their heads on straight about finances. Okay? It's very subtle, but patients pick up on whether or not a dentist is comfortable with finances. Okay? And the dentist needs to realize a few things. One is that he is able to offer a service that very few people in the world can offer, and that he or she is entitled to get paid well for what he or she does. Okay? There should never be any guilt attached for expecting to be paid. The other thing is that you don't need to ever take the patient's concerns too much onto yourself. Okay, the patient may be stressed about money. They may be stressed about how they're going to pay for their dental bills. And you have to be realistic. You have to be empathetic, but you don't want to take their anxiety onto you. That's the path to being stressed and unhappy as a dentist. Don't make the patient's problems your problems. Again, be empathetic, but don't take the problems onto yourself more than you need to.
Can you elaborate a little bit on that? Because, for example, there were few patients that I've seen like recently, and they are talking about that how finances are a big barrier for them. They are on social security, they cannot afford, ABC. And now I know that if I will be talking about having extractions and a partial with them, they're going to be immediately losing the conversation or interest in their treatment. So I have to talk through them because that's a new patient exam. So I have to tell them what needs to be done.
Mhm.
And if I do that, then I'm losing them because the patient is just talking to me about what financial hiccups the patient is going through. So can you elaborate a little bit on that? Like, how can we be empathetic, but still not diving into or having that burden that the patient is trying to put on me regarding the finances now?
First thing I'll say to the patient is, I recognize that you can only do what you can do financially, and that we have to work within your budget. And we're going to do everything within our power to make that as easy as possible for you. Period. May I make one more observation about
Yes.
dentists in general?
Yes.
We talk too much. We use too many words. Okay, we get the best results and the best understanding using the fewest number of precisely chosen words. So did you see how few words I use there?
Yes.
I recognize that we have to work within your budget. A. So we're not going to be tying you down, putting you in debt for the rest of your life. That's what they're thinking. And we'll do everything we can to make it as easy as possible for you. Period. And then you sit silent and you listen. Don't talk, listen. Do you mind if I show you one more example of
Sure.
not talking so much?
Yes.
You know, if I was, I'd like to have a poster 10 feet high that says less is more, the least words possible.
Okay.
Okay. And where I hear this all the time is when dentists are explaining treatment to a patient. And
Yes.
God, we think that we're doing the patient a favor when we give every little detail and we pull out a million charts and models and we talk and talk and talk, and patients don't want to know that stuff.
That's so true.
Do you want to know? Let me tell you what patients want to know. They only want to know four things. Okay. Is it going to hurt? Do I really need this? In as few words as possible. What are you going to do in as few words as possible? And eventually, what's it going to cost? Okay. You know that I used to do mainly endo, right?
Yes, I remember that.
Okay. Do you want to hear my whole endo speech?
100.
Patient patient comes in and they're told they need a root canal. Okay. Here's my whole speech. Mary, first thing I want to tell you is I refuse to let this hurt you at all. I will not allow you to feel any pain. And I got to the point where I could deliver on that. Okay, that's the first thing they want to know. Second thing, we're doing this because we don't want you to get a really bad infection that could end you up in the hospital or give you a toothache that makes you cry. What we're going to do is clean everything bad out of your tooth. Everything that can cause an infection or pain gets cleaned out, and then we lock out the infection. And that's all there is to it. And we'll have Mary at the front desk talk to you about what all this cost.
That's just
That's it.
for the endo part. You have not talked about the crown part that needs to be done.
That's just that. You want to hear the crown part? Don't forget the four things we need to tell them. Okay, always start off with pain. Because if they're nervous that it's going to hurt, they can't hear anything else you say.
Right.
Okay. First thing I'm going to tell you, John, is that I'm not going to let this crown procedure hurt you at all. What I'm going to do is trim the tooth to give it the shape we need for doing the crown. You're going to leave with a nice temporary crown that's going to keep you comfortable. And then you're going to come back and we're going to fit the crown over the tooth that we've trimmed and glue it on. And you get good at it. And sometimes you have to be disciplined because you want to tell them more and you want to tell them about margins or this or that. They don't want to know that. Why do I need it? We don't want your tooth to break. What are
I
you going to do? We're going
I
to trim it and cover it up, glue
I
it on. And this stuff is so easy. There is nothing hard about great communication. It's the easiest thing in the world. Okay. First, you got to know what are my targets in the situation. And then you have to learn a few hacks for hitting the target. And then you practice them. It happens within weeks. It's not magic.